The patient admitted at the Kenyatta National Hospital had traveled from Liberia, which is one of the countries worst hit by the Ebola virus. According to Health Cabinet Secretary James Macharia, the results will be out at around 10 p.m. today to confirm whether the patient has or doesn't have the Ebola virus. Ebola continues to spread at an alarming rate in parts of West Africa and has caused fears in parts of Kenya. This was evident when a patient was taken to Garissa Referral Hospital with symptoms similar to Ebola. The health officials doing their best at taking care of the case the best way they knew how. But it is what transpired next after the man died that continues to raise concerns that perhaps the public is ill-prepared to deal with cases of Ebola. The family went ahead and buried their kin. These information gaps, according to experts, are dangerous.
The Muslim community, as you know, there are a lot of practices in our communities, whereby, for example, some communities wash the body, others do the viewing, they do whatever. So we are trying to educate Kenyans. We shall be sending leaflets and flyers to every county to educate Kenyans on what they need to do. Because some of the people who have died are actually mortuary attendants. Because they touch the body, they don't know how to handle the bodies and so forth.
Kenya's vulnerability is not in question, as it remains one of the main transport hubs in the African continent, with flights to and from the worst affected countries in West Africa. The national carrier Kenya Airways declined to suspend flights to the West Africa destination despite intense pressure.
Early this morning, we sent 2 doctors, one to Freetown and one to Monrovia, to come back on Tuesday to give us first-hand information on the situation on the ground. If they come and say that they're not satisfied with what they saw in terms of screening of the exit passengers, then indeed we shall recommend to Kenya Airways to stop flying to those countries.
It is a disease that has caused global havoc, and panic continues to spread, as the World Health Organization estimates that the number of people who have died from Ebola stands at 1,069 people.
God forbid, if we are to have one case coming into this country, we have developed a very robust contingency plan which touches on every county, including Laikipia. And so that contingency plan is going to cost us 530 million shillings to be able to roll out, and it is touching on every county.
East Africa remains unscathed so far. For Citizen Weekend, I am Mawathe.